Good morning. Glad to have folks with us this morning. And we're trying to get Dr. Corder to join us from the Allegany Health Department. We're working right now to get her online. So if there are questions that you have that you want to ask for the Allegany County Health Department, we will get that as soon as we can. But please feel free if you have questions you want to bring forward. I'll be glad to start answering questions from folks here. This is your time, and I'll be glad to answer questions people may have. And good morning, Ali. I see you said hello. Good. We do have Leon Wyden on with us, Mike Mathias, and Artie Travis. So we do have all that information. There's a question here from Shannon. Has the census data been released yet? Yes, we have released the data. It came out last week. If you give me a second, I can give you that information. I'm pulling up the data right now for you. Overall, the head count for last year was 5178. That includes undergrads and grads. This year it's 4858. That's a 6.6% drop. The campus number here, one of the concerns that I shared with leadership, and I think with the Senate, Staff Senate, and Faculty Senate, the campus numbers here, we saw an 8.2% drop. And consistent with what other schools saw, and I wish it wasn't as great, but our first time incoming number was 740 last year, and it's 629, which is a 15% drop. So we have overall on campus a 6.6% drop. The head count number is 4858 compared to 5178. I will tell you that I met with Alan Walker and Bill Kraus, who's our interim director of admissions, and we've set a target to get back to that 740 from last year for this year. So we're working to get that number back up, and we are going to be doing a little bit more information perhaps than you're asking in the question, but until we get some more questions. We are going to be doing some open houses on campus. According to Bill, we'll be one of only 2 schools he's aware of at this point that are going to be doing on-campus visits. We'll be doing social distancing, limiting the number of families that can come on campus. I've had some preliminary discussions with faculty leadership about whether it should be open to all disciplines or we should have it discipline specific. We'll see what Bill thinks makes the most sense to optimize our time. What I think is important if we have an open house, it's one thing when you have 250 people here. It's a different thing when you have only 40 or 50 or 60 people here. How do we make sure that we use the time of our faculty and staff wisely for anybody that might be here? So there'll be more details on that, but I think Bill is planning to start. We'll still be doing tours. And again, people who come on campus will be asked to do the symptomatic checking. We'll check temperatures. There'll be social distancing on any tours. There's a route that's already been determined to do it effectively, but yet maintain the safety we need to. So one of the things, for instance, that will not be on tours will be actually going into residence halls, but we will be able to provide them some information and some videos about what the residence halls look like. Okay. What is FSU's response to the latest allegations about Missy Martz regarding sexually harassing a trans student? I will tell you we've looked into it, and again, I'm trying to protect personnel things. The information that was given to us anonymously through social media, which I assume is the question that's being referred to, the facts that we have and the facts that we've been able to gather are not consistent with what was reported in the anonymous posting. I think that's fairly accurate. I see one of my VPs saying yes. Do we have a timeline for when furlough reductions will be announced? Yes, we're working on it right now. We've had discussions with staff and faculty leadership. In fact, we had as some people may know, we've been talking about this for several months when Vice President Wyden pointed out that we really needed to close the gap on this year's budget. We're looking at about a $1.4 million plus gap that we need to close. We've proposed a couple different scenarios to both staff and faculty leadership. As recently as last evening, we were still exchanging some discussion points about some of the finer points. I anticipate that we'll be having this done by early next week. And I do know we have to also talk with the unions and the collective bargaining, those staff people that are in the collective bargaining agreement. So more information will be coming out about that as we move along. One thing that I will mention, and again, it's part of this, given, and again, I know the chancellor mentioned it, that I will be taking a 10% cut. So that's part of the presidents at all of the institutions that are looking at the savings we need from either furloughs or salary reductions. All of the presidents in the system have agreed to at least a 10% cut that they will be taking in terms of leadership. So put that out on the table already. The other thing we are looking at, I do know in talking with Vice President Wyden yesterday, none of the plans at this point include any layoffs. Is that right, Leon? Am I correct on that?
Yes, Ron, that's correct. We have no plans at this point for layoffs. We're looking at a salary reduction plan. And as soon as we've reached some agreements and have a few further conversations, the president will announce exactly what the graduation of that is going to be and what that looks like. So yes, that's correct, Ron.
Thank you. Question from Michelle. The news mentioned USM might not open due to COVID. I assume you mean College Park, and there was talk of pay cuts. I know we discussed this last coffee talk. Is there anything new? I don't know what's going on at College Park. I haven't heard anything more recently. Last I heard from them, I think was yesterday, their positivity rate was fairly low, but I don't know of any plans. I know I think they were going to go online for the first 2 weeks and then switch to face-to-face for some of their courses. I don't know of any changes that have been made in that regard. The only school I'm aware of that has gone completely online is Towson. And I heard yesterday UMBC, I think their president mentioned only about 9% of their classes are being held on campus. We're in week 4 right now. The only school that has been ahead of us is UMES. They're in week 5. And I think quite a bit of the success we've had has been a result of the fact that we've been fortunate in that we're in an area where the virus is not at the same level as it is in some other counties. So that's helped us as well. Pay cuts, we just talked about this. We will be looking at whether it's going to be furloughs, that is some furlough days, or we'll be doing salary reduction or a combination of both. We've put out some models, some ideas, some different scenarios. They've been ongoing discussions for several months now as we've been working through different scenarios. And as I said, we hope to have that finalized early next week. What is happening to the students hosting parties? Artie, do you want to talk about that?
Yeah, once we are put on notice about students on campus or off campus having parties, citations are issued off campus, and incident reports are filed on campus. At this point in time, we've had a number of videos and other information submitted to us. We're asking students or any people in the community to call the campus police tip line or send an email to student affairs at frostburg.edu. We are calling the landlords to make contact with the owners of the off-campus apartments. We're calling those students in and other students that we can identify for a show cause hearing, and then we're having conduct hearings. We've had over 10 incidents right now that have resulted in probation and other fines for the students. Any student that has been identified or caught on or off-campus party has automatically been suspended on an interim basis and cannot come back to campus unless they show proof of a negative COVID test. And then we will have the formal hearings with the students.
Thanks, Artie. I appreciate that. Dr. Corder has joined us by phone. Jennifer Corder is the medical deputy health officer for both Allegany and Garrett County. So Dr. Corder, welcome. Give you a chance if you want to just say hello real quick. If we can get the phone.
Hi, this is Dr. Corder. I'm wondering if you can hear me.
Yes, we can hear you. Thank you. Glad to have you with us.
Thanks.
This
Yeah,
technology
thank
can be
you.
a challenge. I'm sorry, go ahead.
It's a challenge, but I'm trying actually, as we speak, to still click through so that my video will come on, but we'll see if that works or not.
Okay.
I am happy to be here today to try to help to sort of answer some questions about COVID-19 on campus and about what the health department does when we have a new case and how these case investigations are done, and then contact tracing and all that sort of thing. So I'm happy to just sort of go through some general statements about any other normal contact tracing and case investigation that we do and we've always done, and then field questions, more specific questions as they come up. How does that sound?
That makes sense. Why don't you do that, and then I will throw some questions to you that we're getting on the chat session for you to specifically respond to, but please go ahead. And thanks for being with us.
Okay. Oh, sure. Thanks. I feel like I'm just so close to being able to have my video on, but I'm just going to opt to talk at this point. So all local health departments have a team of people that work within our communicable diseases division. And, you know, we have lots of different germs in the world that are considered communicable, which means they can spread from person to person. And each of these different germs has their own rules and different incubation periods and lengths of quarantine are different. Everyone has their own rules. So we've added this COVID-19, the virus that causes COVID-19 is a SARS-CoV-2 virus. And we've added that since the end of the year to our communicable diseases. All of these are what we call reportable diseases, meaning that a lab who has a result positive for a reportable disease, or a physician or nurse practitioner who received the result back of one of these diseases on the list must by law report it to the local health department. And the state health department also becomes aware because of our reporting. So COVID-19 is a reportable disease, as we all know at this point. And the large bulk of what our team does right now is responding to reports of positive PCR tests for COVID-19. On the side, we still respond to cases of salmonella or Lyme disease, so that's not really communicable. It's reportable. And we do all the other diseases as well, but the bulk of our energies right now has been COVID-19. So what happens is the lab, you go and you get a sample taken, and the sample gets sent to an unspecified lab. The patient is usually not sure what lab their sample is being sent to. The sample goes off, the lab gets an answer. Let's say it's positive. By law, the lab has to report that to the ordering provider and the health department. So that can happen electronically in the larger labs, and otherwise we still use old fax machines for some of the reporting. So we still check the office every day on an old-fashioned fax machine. Some of the smaller labs don't have electronic reporting. So we get a piece of paper or results in our platform that says so-and-so tested positive for COVID-19. The first thing we do is the nurse on that team will identify that case, reach out. Of course, when you have your sample taken, they ask you some demographics like your phone number, a way to contact you, your address. So we're using that information, which is shared from the lab. We reach out and we get that person on the phone typically, and we let them know the result. Sometimes they already know the result because their provider, who has also been informed of the results, may have already called them. In any case, the job of the local health department is to have a discussion about this individual's experience with COVID-19, their individual story, and each one is unique. So, for example, some people have no symptoms. They were tested on a whim. Other people are in the hospital sick and can't talk to you. So what we need to determine from that conversation are a few things. And we need to determine their onset of illness, if they are ill. And by knowing that date, we can calculate their period of infectivity. That period of time, they're capable of spreading it to another person. And by definition, at this point, we know that we subtract 2 days. If you have symptoms, we go back 2 days prior to onset of symptoms, and then we count out for 10 days. And that's how we define someone's period of infectivity. And if they have no symptoms, we count from the day of their test for 10 days. During that time, we tell them to isolate from other people. And the purpose of that is so that they don't transmit it to somebody else. And so we use the term isolation for someone who has a positive test, with or without symptoms. But typically a sick person isolates. A healthy person who's been exposed quarantines. So in that initial conversation, once we figure out the isolation period and we define it for them and inform them of that, we also ask them if they need support during their period of isolation. Do they need social support, food delivered? Do they need anything else? Are they okay with housing? Do they ideally have their own bathroom? If they're living with a household, there's lots of things that can be discussed then. But we further go on to the conversation about, you know, who have you been around? Where have you been up until now from the time you started being infectious to others? So we ask that they go through, sometimes we ask them to open up their calendar on their phone, remind themselves of what they were doing last Thursday. And we go day by day. And sometimes we find out they haven't been anywhere at all and there's no close contacts identified. And other times people have worked for 3 days, gone to a wedding reception in the interim, only to find out their test was positive. So, and we have a lot of close contacts for that case. So the person who is the case is asked to help us identify close contacts. And the definition that we use is with people who they've been around for more than 15 minutes and under 6 feet distance, with or without a mask. I want to reiterate that. For social community exposures, the guidance from the CDC absolutely reads, it doesn't matter if you're wearing a mask or not, because we're really just using cloth face coverings in the community. We're not using N95s. And for that reason, we know that cloth doesn't really prevent ultimately transmission. It just buys us some more time. So with or without a mask, within 15 feet, within 6 feet for more than 15 minutes, we come up with a list and we ask the case to give us contact information, names and telephone numbers. All of this depends on, success at getting this list depends on the case cooperating with that. Sometimes people are very nervous and upset to share other people's information. Sometimes they don't know the name of the person they were in contact with or the phone number. So sometimes we have some dead ends, but most of the time we have helpful information, even if it's partial information that we can go on. And once the case has been sort of tucked in, they know what's going on, they seem agreeable to the plan, we hang up the phone and we start reaching out to those close contacts. Those folks may or may not know that they've been exposed. It could be a complete blindside kind of phone call. And sometimes it's, oh yeah, he told me about his test result. I knew he was sick and I expected this call. So it can run the range. For those folks, we talk about a quarantine period if they are themselves without symptoms. If they have symptoms, we recommend they get tested for sure. We actually recommend they get tested if they're a close contact regardless. At this point, we want to know as much as possible about transmission. But in any case, we talk to them about the exposure. We define when that last moment of exposure was. For some people, if it was a workplace, for example, it may have been Tuesday, Wednesday, and Thursday was the last day of exposure. That becomes the point of the onset of your quarantine. It's really the last day, not the first day of your exposure, but the last time that you were in contact with the case. And then you count out 14 days because we know that this virus can take that long to manifest itself in a new case. And that's why a quarantine period that's how we came up with, it's got a scientific basis. So isolation periods are 10 and reflect the period of infectivity. Quarantine periods are 14 days and reflect incubation period, the potential length of the incubation period of the germ. Those examples that I gave are pretty understandable. I think there's one sort of situation that I can bring up now that has to do with close contacts who happen to be household contacts. And like I was saying before in the work example, someone who has a continuing exposure like a household contact would has to think about their quarantine beginning only at the end of the period of infectivity of the case. So if you try to follow along with me, if a case occurs in a household and we start counting for 10 days that person is infectious to his household members, and they do everything they can to prevent transmission, but since they're household members, it's pretty tough to avoid exposure. And if we get exposed, since we do not have immunity, it's pretty good likelihood we'll get it. So the case has 10 days and they're living at home. They have nowhere else to move to. So for that entire 10 days, the household contacts are in a waiting period. They try really hard not to be exposed, but on that 10th day might be the day they get exposed. For that reason, we don't begin our quarantine period until the end of the infectious period of the case. So this ends up being 3 weeks in some cases for household contacts. Okay? So when you cease being in contact with the case is only then when you can begin your quarantine. And in household contacts, it's a little bit, it's a longer duration because they don't cease their contact unless they have a second home to move to. And that's a unique situation. So once we've done our contact tracing, everybody's aware, everybody's sort of tucked in, and then we make interval phone calls to each of these categories of people over time until the period of infectivity is over or until they're released from quarantine. We can supply people with release from quarantine letters. We can supply people with letters that say, what their quarantine period is for work purposes or isolation period for that matter. And in general, that's what we do. We keep stats on cases that occur in residents of Allegany County. We have our own internal spreadsheet so we can look at trends and monitor the situation locally, which is an interesting thing to do. And we've had 2 sort of data releases related to our local data over the past month. The last one was a few weeks ago, maybe 2 or 3 weeks ago. So that's what we do for all kinds of communicable diseases that need to have case investigations and contact tracing. COVID-19 is the bulk of what we're doing these days.
Thank you so much for that. I've got a lot of questions here, and I'm going to group them. Some deal with follow-up on the questions about contact tracing and also close contact. One question is, will we, that is Allegany Health Department, be participating in the contact tracing that's now available on smartphones?
That I've heard of this capability coming down the pike, but we haven't been fully oriented to that technology. At least myself, I have not as a deputy health officer. I do not believe that my health officer, Janelle Mayer, has been either, but they're meeting right now, the health officers. So every day we learn more. And I'm sorry, I don't have any specific information about that. I think I might be getting on the video. Can anybody see me?
Not yet. At least I'm not seeing it up here. We have your name up on a slide right now, and we'll wait and see if that video comes up.
Oh, well, we'll continue on then with that.
Sure. And again, I appreciate your comment about not knowing. I'm on calls 2 or 3 times a week with the system and the Maryland system. And we're, for instance, now still trying to get updates on the rapid testing and changes that are going on. And it sounds like it's a day-by-day learning curve for us all. Here's a question about close contact. Can you talk more about what a close contact interaction would need to look like for contact tracing? Here's the thing, especially within a classroom, that is, what kind of interaction in the classroom would need to happen with a positive case for a professor and the other students to be notified for contact tracing?
Yeah, this is the golden question. So ideally, people are wearing the face coverings, but we do know that they are congregating in rooms when we're talking about school classrooms, physically present, that we're sitting longer than 15 minutes in close proximity to one another. Mind you, maybe not 6 feet or less, but 8 feet, 10 feet, and it's way longer than 15 minutes. But there's been no extrapolation of that 15-minute, 6-foot directive whatsoever. In other words, nobody has said, okay, well, if you're 10 feet, we need to give you an hour. But, logic would say that the germ will, if somebody was infectious, it can get out, it can get between the fibers of a cloth face covering and enter into the air and linger there and potentially be acquired by somebody else if you sit long enough. But we have no data to sort of to be able to say with any certainty, okay, well, we only have 45 minutes here in this room, we got to move on. We're going to learn from our experiences and by keeping track of what were our exposures. But we also have to keep in mind that it's going to be very, very difficult to ever prove where we actually acquired it. Because most of us are going to the supermarket and filling our gas tanks from time to time. So, short of having a household contact or a definitive, bona fide, close contact, unprotected with a case, we're not going to have too many ways to prove it without a doubt. What we talk about is epidemiologic linkage of cases, so that if you had a classroom with a case, the case goes home to isolate, and we say with our best judgment, we had no close contacts. That person stays over there in that corner. They were always masked. Everybody else was masked, way over 6 feet. We're not going to call anybody and say you need to quarantine for that. Now, if a week later we find out there's another person in that same class that comes down with it, who happened to be the person that sits closest to the case, or 2 people, then we've learned something. And we go, oh, well, I can't prove it, but it sure seems like we have a number of cases that we can't tie back to any other place but that classroom and that initial case. Unfortunately, we're in this position of learning from experience because this hasn't been done before. And I do anticipate that we're going to learn from experience. And what's for sure is if people don't mask and don't distance, then we'll have more transmission. So everything after that is on sort of a spectrum, right? So if you've got 25 people in a room versus 12, that's a higher risk, and so on. And if you are all barely 6 feet versus 8 or 10, that's a relatively higher risk. So all we know is this: we have a spectrum of risk that we're taking. If it's a class where everybody's singing and it's about voice, we know that's a higher risk class. So we just know these generalities, and we're all working on a spectrum of risk, and we all are acknowledging that by participating in life, we are agreeing to some degree of increased risk of acquiring it. But that's the situation the world is in. That's just where we are, and we are having to navigate it and walk into this fire, and we'll have to come out the other side. So we're talking about doing it as safely as possible by purposefully choosing the lower risk spectrum scenarios to interact with. So we're talking higher level education. People are in control of their own behavior versus 3rd graders or 1st graders. And it's a different conversation in these situations, right?
Yep. Here's another question, and it gets back to your comments about isolation and quarantine. Should faculty and staff have to provide a negative test result before returning to campus after testing positive for COVID-19?
That's a good question, and we've heard this discussion before. The answer is no. They shouldn't have to provide a negative. They should have to provide documentation that they've served out their isolation period or quarantine period. That's important, really important, that those periods of time are spent alone and in a very thoughtful way, being responsible for yourself and the greater community by not exposing others to you while you're either a case or you may be incubating it. And so these periods of time, documentation that they have been fulfilled is what is important.
Thank you for that answer too, because that was one of the things I had to learn too from Katie Morale, who explained to me, because again, I would say not call it common sense, but the common thinking would be, oh, you need to have another test, but your answer on what's been provided through science has been helpful. We have 3 questions with regard to positivity rates. One deals with the county, and the other 2, I think, deal more specifically with the campus and your thoughts on that. But let me do the county one first. This says Allegany County has one of the lower case rates This one here's in parentheses says 408 confirmed by Johns Hopkins, but a higher case fatality rate, 22 confirmed with a rate of 5.30. Do you have any explanation as to why we have this discrepancy?
Yeah, so the fact is, early in our experience, we really got clobbered in the older age group categories of people who were living in long-term care facilities. And we had several of the facilities in the county who had outbreaks. One particular one was exceptionally widespread and affected a lot of people. So fact is, most of the people who acquired it did not die, even in their 80s. You know, we know that their risk is much higher though, and for death or for any other bad outcome. And we have seen that. So we are skewed to higher mortality because the proportion of our cases is still measuring out that they were the elderly in poor health to begin with. I anticipate that this will edge down as we have more and more cases in young people who, for the most part, don't get that ill. We have had another, so that it's one thing to focus on, it's kind of interesting and to know that deaths are attributed to a county of permanent residence. So a person who lived in Carroll County and lived in a long-term care facility there, who became a case there and was counted as a case in Carroll County, but permanent residence is Cumberland. Upon death, the death is attributed to Allegany County. That's just by convention. That's how we do it all across the nation. And it has to be done some way, and that's how it's done for all, not just COVID deaths. So the permanent residence jurisdiction as identified by the family is where the death is counted. So we have had at least 3 deaths attributed to Allegany County who were technically not our cases. So that can help skew the number as well.
And thank you, because that's a follow-up. Here's this question about positivity in cases, getting some questions now specifically on this. And I think you may want to just expand a little bit on this, but it says, I've been monitoring all the status reports published by the Allegany County Health Department since the pandemic began, but the numbers do not seem to reflect the positive cases reported by testing of the FSU community. Are those cases including the Allegany County totals or not?
So the cases that are included in the Allegany County totals will be the cases who are positive only in people who reside in Allegany County. So no, not all of them from FSU will be in the total reported by Allegany County Health Department. You have to be a resident of our county to be counted as a case.
Okay, thank you. And let's go to the questions about the campus, because there's a couple here that people have asked. Let's see, one was, I'm going to scroll through this. As you know, we did what I call baseline testing when people came back to campus and tested over 3,000 people. And then we've been doing surveillance testing every 2 weeks. Last week we tested and reported results of 600 people. And so the question came up, are you concerned that the positivity rate was higher for a smaller number of people? That is, the last test we did 600, and I think our positivity rate was 0.95, compared to the first large number of people tested, where it was 0.66, I think, approximately.
Right.
So is there any concern about the positivity rate being higher with the smaller number compared to the first larger number of people?
Well, yeah, I mean, we all pick up on that. I've seen that and made a note of that, but I don't think 1 point creates a trend. We just have to wait and see what we have the next time you report. Then we'll have a little trend if it's higher again. But, you know, I don't really honestly expect that young people on Frostburg campus are gonna necessarily be different. I hope they are from behaviors we've seen described on other campuses. They certainly could be, like, we could be pleasantly surprised. And I give young people responsibility for their own behaviors, and I hope for the best. Don't get me wrong, but we haven't seen great stories in lots of other campuses. But we hope we're going to be an outlier there. Yeah, we don't see a trend.
I agree with you. I hope I'm keeping my fingers crossed as well. This is a tough one, and I don't even have an answer to it. I don't know if you have one. What would be a positivity rate for us on campus for you to become concerned about? Do you have a magical number, or what would you be? Is it the trends you'd be looking at? How would you respond? What would cause concern for you for the Allegany Health Department?
I think I don't think we have like a trigger number itself. I think it's the whole picture, and it's more of like concern would be more driven by art than science. It would be looking at your positivity rate trend, but also looking at the number of reports of parties and number of, I think it would maybe look at different things to come up with, oh yeah, well, things aren't going well. The positivity rate is obviously one good way, but if you're getting lots of reports concerning behavior, then that's also sort of like a predictor, maybe.
Okay. This is a question about the testing. If you take a test early, and we've been doing the PCR test in the exposure period, will the test be sensitive enough to determine that the virus is present?
Great question. Yeah, so the typical, if a person who's just acquired the infection is going to become symptomatic, the median length of time it takes looks like it's 5 days. As we know, some people never develop symptoms at all, but because the median length of time to onset of symptoms is 5 days, I've kind of, if somebody asks me, I say to them, you know, if you've been exposed and you have no symptoms yet, give it about 5 days and then get your test. If you've been exposed and you develop any symptom at all, go for it, get your test now. And that's kind of how I'm going. For that reason, I don't think that getting a test 12 hours later, you might miss an opportunity to detect it because you kind of a little too ahead, jumping out ahead of the game. It's entirely possible that you'll get a negative. It's a true negative, but you're still incubating and you just haven't shown it yet. So there's also the opportunity to repeat testing for that same person. If they get one right away and then 3 days later they're not feeling so well, they absolutely need to get tested again.
Good, thank you. This is a question about how often does we have several residence halls that have community bathrooms, and the question is, how often does the health department recommend that community restrooms in living facilities be cleaned or sanitized? Any recommendation there?
Wow, that's a really good question. I have to admit, I haven't focused on if there's specific guidance for that, you know, short of at least daily. But I would think that I would ask the people who use, say, a communal bathroom to be in charge of some of that as well. If you have supplies that they can participate in cleaning up after themselves, that's a good idea, to wipe down high touch surfaces, the handles, the knobs. To participate a little would be, you know, it makes sense if that seemed to make sense from your end. But I'd have to get back to you to see if there's any specifics. I don't know, and I don't want to say there's not, I just haven't focused on it.
Appreciate that. Artie, our Vice President for Student Affairs. Artie, do you know what we're doing in the residence life in the residence halls for the communal bathrooms? You're muted.
They're
You muted yourself again. Oh, okay.
They're doing a cleaning on a daily basis, and then they're also following back up with high touch area to do disinfect disinfectant cleaning in the residence halls, in the public areas, in the restrooms.
Thank you. Okay. This is the last question I think I see for Dr. Corder, but can you talk about what post-COVID symptoms you might be seeing? Are you seeing any post-COVID symptoms?
You know, one of the other people who's one of our contact tracing nurses, Michelle McDougall, was going to try to be on this call with me, and she was unable. She'd be the best person because she's helping to make the calls that I talked to you about. And I know she's aware of some cases that are, let's say maybe they're immunocompromised and things are going a little more slowly for them. But by and large, I have not heard her talk, and we meet 3 times a week, about any kind of clusters of, you know, long haulers or any kind of problematic. In general, I haven't heard. That's not to say there may not be a few. So I'd have to get back to you on that as well.
Okay. And I think you answered this other one earlier, but cases are track recorded. Someone works in Allegany but lives in another county. If they're reported, it's really reported in the other county, not Allegany. Is that correct?
Yes, by convention, we have the cases attributed to the county of residence. So in that, the health department in another county would identify the workplace with that case, and that there would be some sort of outreach that they would basically ask the case to contact the employer, and we can assist with that, maintaining confidentiality, and to help pursue more contact tracing. So sometimes employers are part of this contact tracing effort, but unless if the case gives permission, then the name can be used. Otherwise, it's done without disclosing the name.
Well, Dr. Carter, I want to thank you. I know you've taken a lot of time out of your schedule this morning, and I hope if we find a need in a few weeks, hopefully things will stay quiet, and we will continue to move along, keeping our fingers crossed that students, and again, one of the things I've been pleased with is we've been seeing by and large a lot of appropriate behavior of our students on campus. Off campus, that's Dr. Travis has been working hard to work with our students to understand what's appropriate on off-campus behavior. But I want to thank you for taking the time, and we would certainly, welcome you back at a later time if we have additional questions.
Sure.
And maybe we'll get the
That's
camera
great.
working for you too.
Yeah, we did a test run yesterday. It was beautiful, but I don't know what happened today. But anyhow, it was my pleasure, and I'm happy to keep troubleshooting and talking and sharing what we learn along the way of this journey.
Well, thank you again, and thank you for working closely with our health department on campus here. That's been a big help, helping us navigate, and certainly
Sure.
with the university. So thank you so much for your time.
Thank you.
Thanks.
Take care.
Okay. Bye-bye.
Bye.
Well, I appreciate Dr. Corder being with us. Now let me go back to some questions in the last few minutes here that we've got that I can answer on other issues that people have come up with. And again, if you have other questions, I'll be glad to, on the health that come up, I'll be glad to forward those on to Katie Morrell, our Brady Health Director, for her to address as best she can. Let's see. Questions about fall commencement. Students have been asking about fall commencement. When will we know if it's going to be in person or virtual? We'll make that announcement sometime early October. At this point, I anticipate it's going to be virtual. We will again do a delay if we do decide to go virtual. The only circumstances I can see is if things really improve a lot and we're not seeing issues and the governor loosens up the requirements of as far as in-person gatherings. But if you're reading the paper like I am and seeing things that are going on, I think that's not going to be likely, but we will wait until early October to make that decision. Do students have access to any training in setting up Teams meetings as group projects are assigned? This might be helpful for them. Mike, do you know offhand if we're doing anything for Teams training for students?
I don't know offhand, but I've noted that question, and I'll reach out to instructional design and technology and get an answer to it.
Thank you, Mike. Appreciate that. What is the status of teleworking? Will FSU offices be moving back to in-person staffing now that the state has entered stage 3 as of its recovery plan? We're leaving that to the vice presidents in each division to work with their staff. What we're finding in some instances is the teleworking. Again, the lower density on campus is to our advantage, and we're not at the point where we're ready to bring everybody back. If there are needs that a vice president feels that they need individuals back on campus, it's certainly something that they're working with. So I would encourage individuals who are teleworking to stay in contact with the supervisors about the work plans, but there is no plan at this point. We're leaving it within the divisions. Again, I'm finding it helpful to keep the my executive assistant is teleworking a good part of the week. I think it's good for us to keep the density on campus down. The virus is still in the area, but again, my response there would be to talk with your supervisor and then also through the vice president to make decisions about changes that need to be made. Let's see, going back down here. Oh, several students emailed me that they feel sick. Are they eligible for taking the COVID-19 test at FSU when they feel sick? The answer is yes. What they need to do is contact the Brady Health Center, and Katie Morale and her staff will walk the students through a series of questions to determine whether or not they need a COVID-19 test. It's important that they call, that they do not just go over to the health center, but the first thing to do is to call the health center, Brady Health Center. In discussions with our director, Katie Morale, she has told me on a number of occasions there is an incidence of allergies on campus, and that we've had a lot of students, I should say a lot of students, number of students that have called and given symptoms that seem to be related to allergies. The symptomatic testing that I'm aware of that has been done, that is students that have reported symptoms and have actually had the COVID-19 test have come back negative. So we've been fortunate in that case so far. But yes, the answer to the question is yes, they should call the Brady Health Center. And if you're a faculty or staff member, you should call your healthcare provider to determine whether or not you need to take a test or not. I will share too, this I guess maybe the first time to share this publicly. We've been requested by the state system to do another round of baseline testing following Labor Day, and our recovery team is working on that right now. It will likely be not next week, but the week after. The beginning of that week, we will do another round of baseline testing of everybody on campus at the request of the state system. With more information coming out on that. Now, some people have been requested who've been randomly selected to be part of the surveillance testing next week. That will be continuing. We will do our biweekly surveillance testing. That is we're hoping to get a sample of around 200 to 240 individuals. If you've been identified as an individual who's been randomly selected, we ask that you go ahead and set up the appointment for that. And I would ask the faculty who are on the call here, please encourage your students to check their emails. We've had students who have said, well, I didn't know I was selected to do the surveillance testing. And it's the reflection, it's frustrating for our people who are sending them up to 10 emails to them that are not being read. So please encourage students. We've done it when I met with the students the other day, and I've asked SGA to help us take a lead on this. A responsible behavior on the part of the students every day is that they should at least check their emails once a day to see what's in there, if there's any messages from the campus that they should be aware of. Also, I would certainly encourage faculty. I know if I were teaching in the classroom right now, every once in a while I would ask students to show you their badge, to show you that in fact they've, you know, again, here's mine today, if I can pull it up. You know, this is the showing that I've got cleared to be on campus. Feel free to ask students to do that coming to class. It's important that we remind them to do the symptom checking on a daily basis. It keeps everybody's mind on the fact that we're involved in this. In fact, the students have asked, I just told you that they're not checking emails yet. In our call Tuesday night with SGA, students said, can you send us an email to remind us? And so I've asked SGA, I said, I'm sort of in a quandary. Students are saying they don't check their emails, and then some students are saying, would you send us an email reminder? So I've asked them to find out what they would like us to do. I'm moving forward on that. This is a question, I think, for you, Mike. If faculty are having second thoughts about having in-person classes based on new information, can we switch to completely online testing?
Sure, thanks. So faculty may not unilaterally switch from a blended modality to an online modality. Our students have come with the expectation that they're going to have in-person learning interactions and a desire for in-person learning. Our students have incurred significant financial obligations in the forms of leases and housing contracts. You know, we've communicated that we're going to provide in-person learning opportunities for our students, and again, we need to stick with that. You know, I would ask faculty who do have concerns to talk to their department chair, to talk to their dean about what those concerns are, and think about ways that you might mitigate any concerns. Again, the blended modality provides a significant, intentionally provides a significant amount of flexibility in how an instructor approaches the balance between online and in-person learning. So again, you know, the quick and easy thing is to switch to an online modality. But again, if we can have a conversation about how to maintain in-person learning in a way that addresses the faculty members' concerns, you know, that would be my guidance in the first instance. We did indicate, right, you know, on the application form that we used this summer to, you know, to process requests to teach online. Again, appreciate that circumstances for individuals might change over the course of the semester. So again, if you know, if there really is some significant issue, then again, the process is to discuss that with the department chair, who in turn would make a recommendation to the college dean, and there would be an evaluation of the request at that point. So.
Thanks, Mike. I appreciate that very much. I think we've hit all the questions. I just want to share two things in closing with you. I was talking with one of the deans, Dean Williams, this morning, who has been visiting all of the classes in her college and talking with students. And I want to commend the faculty and staff again. The comment that she shared this morning in a meeting off campus with some people in the community is that so many students are responding that they're just glad to be back. They're glad to be able to see their friends, glad to be able to be in the classroom with faculty. And that means a lot to the students. We're in week 4. We hope that we can continue to stay in this modality of being face-to-face with the students on a regular basis. I know it's a challenge for everybody, but everybody seems to be working hard at making it happen. So I want to thank everybody. I know there's a lot of stress and anxiety as we keep going through this, but so far we've been very fortunate, and I hope it continues in that format. The second thing I just want to mention very quickly is that I know some people have asked about another alternative time to the Thursday 9:30 meeting. So because they have classes on Thursday at 9:30. So I'm committed, as long as we have people interested in attending these, to keep this going, but we may look in 2 weeks for another time, perhaps on a Thursday in the afternoon or something, to give those who are not unable to attend early in the morning the opportunity to do that. So with that, I want to again thank everybody for participating. I want to thank Dr. Travis and Leon and Mike Matthias for all being with us this morning to answer questions. I hope everybody remains safe, and thanks again for everything you're doing.